we've really had to change the way we do public health and safety, and I've seen for the most part Canadians are taking care of each other.
Healthcare workers have been named the heroes of the global pandemic. During National Nursing Week, nurses across Metro Vancouver are sharing how their careers have changed during the COVID-19 pandemic.
Every single time we think we got this pandemic understood and know what to do, it throws another curve at us. The hardest part is when you have a patient who is a little bit confused because they're critically ill. They don't know who is taking care of them because we're all wearing masks and goggles, and they can't interact with their family member.
Vinnie Baines is a clinical nurse specialist in critical care here at St. Paul's Hospital in downtown Vancouver. She says over the past 14 months, her day-to-day tasks have changed significantly, and it's something she never would have predicted in her 25 years of nursing.
I never went into nursing school thinking that we would have this once in 100-year pandemic. We had SARS, which was really mild in Vancouver. We had the inklings of H1N1, which was scary, but all of those were, baby compared to this.
At Vancouver General Hospital, Jordan Horvath has been working as an emergency room nurse. He emphasizes just how much work goes into caring for a COVID-19 patient.
Usually we've got someone who's in the room providing care as a nurse. We've got a respiratory therapist in the room, and we have a physician in the room. But outside of the room, we have to have clean providers who are able to go and get things, put in orders, ensure that we have everything we need for that patient available, or at least close to the room, so that they can pass it into us.
And the impacts of COVID-19 trickle down to all units of a hospital. Sherry Kenzel with the Nurses and Nurse Practitioners of BC Association explains how her job working on a hemodialysis unit has also changed.
As we saw more and more patients trickling in with COVID, it was really caring for those patients and really reassuring them that we can keep them safe and we can keep them as healthy as possible. And reassuring the other patients around them. Our hemodialysis patients are immunocompromised, so it's really important that we have that extra layer of protection for them.
But it's not all bad.
We've really shone the light on nursing and the incredible role that we play. And I think that just that sense of pride and that sense of professionalism really helps to elevate ourselves as a profession as well.
And despite being in the third wave of the pandemic, there are several reasons why these nurses continue to show up to work day after day.
In the time of a global pandemic, we always just hope that we've provided excellent care.
I work with the most amazing, courageous, dedicated, incredible people, and it is an honor to spend every day with them. And in this pandemic where we've really pulled together and we've really leaned on each other, I can't abandon them. This is the only place to be.
In Vancouver, Miranda Fatur, City News.